how do you address the issue of addiction to aesthetic procedures?
But it can't be the patient's fault.
Ties into also the balance between natural beauty and an enhanced look.
It's never going to be the same. Two people can come in, two besties can come in, and they'll be like, we both want filler, but you're going to do it completely differently for both of them.
I think the greatest effect is combining education and demonstration.
Aging is a bit of a sticky one. I think it was more my experience now as a young adult rather than when I was a child. You need to choose a field that's going to constantly give you that.
Stay empowered, stay inspired, become unstoppable. Welcome to the Afrimed Podcast. Strap in, it's about to be a good one. Welcome to the Afrimed Podcast. On this episode of the Afrimed Podcast, we have Dr. Zama Ndlovu. Welcome to the podcast, Dr. Ndlovu. How are you feeling today?
I'm great. Thank you so much for having me.
Really appreciate you being here. Really appreciate you being here.
Thank you.
So I want to find out, why have you agreed to do this podcast? Why did you say yes when I messaged you and asked you?
I think it was mainly because you and I know each other from med skills. And I think having interacted a lot with you and some of your other colleagues or friends, I found it very easy to chat with you guys. And I realized that there's actually a lot that you guys can learn from us. I think medicine, it's very different when you're a student versus when you're actually working. And a lot of the questions that you guys were asking were also not just about the skills and, education aspect of medicine, but also how to navigate certain challenges in life. Certain things that happen in our lives and how medicine can impact that. So I was very happy to give you guys advice on that.
Okay, great. Mm-hmm. So you're practicing aesthetic medicine.
Yeah.
To the lay person, what does that mean? What does the job entail?
So aesthetics medicine is, a lot of people would think beauty medicine, but it's actually a lot about making sure that your skin is healthy. And it's also treating a lot of premature signs of aging caused by sun damage and also using the wrong products. And then there's also the other aspect to it, which I enjoy a lot of, which is the face contouring. So when we're able to use certain products to actually change how your face looks, just for more cosmetic and aesthetic reasons, which can also have medical benefits as well.
Okay, that's great to hear.
Good.
Are there any specific childhood memories or experiences that you can share that has maybe influenced your decision to pursue aesthetic medicine?
I've always loved beautiful things. I think a lot of us always think that medicine is just blood and bad looking things and scary looking things. But the aesthetics part of medicine is really, really amazing for me, because I get to do a lot of what I actually enjoy doing outside of medicine, which is to test different skin products and to see my skin looking good. And a lot of things that my friends and I do on the side as well is like trying on makeup. And when you try on makeup, you basically change how your face looks. And a lot of that contouring that you can do with makeup, you can actually do with fillers. You can do with Botox as well. So it actually is a great way for me to sort of balance the two, what I really love doing as a woman and as Zama on the side, but also now incorporated into my work. The other part is that I love doing procedures. So I've got a background in in anesthetics. And in anesthetics, I gravitated towards a lot of the procedures. And I found that I love having needles in my hands. So in aesthetics medicine, there's a lot of injectables that we do, and I love doing that. So yeah, a lot of my childhood memories, and as a teenager and also as a grown woman, I've incorporated all of that, and it fits quite well in medical aesthetics.
I see. So what I wanted to find out, we spoke about beauty and we also have the topic of self-esteem. So are there any particular moments in your upbringing maybe that shaped your view of beauty and self-esteem, and what it means to be confident as an individual?
I think it was more my experience now as a young adult rather than when I was a child. And that is seeing a lot of women, especially I'll speak mainly about women because that's the majority of patients that I see, but also males as well, where people start to have, issues with, I don't like my face because I've got these dark marks, or I'm not as confident as I should be because I've got acne, or, I don't like being around people because people automatically think that I'm a very intimidating person, or I'm not friendly because I've got this crazy frown line. And I realized how much aesthetics, especially medical aesthetics, has an effect on our psychological, or has psychological benefits. And people always think, but it's just superficial and people just want these things for no real reason. But the benefits, especially when you see somebody's self-esteem and their confidence coming out, it's incredible. I remember when I first started, I gave all my aunts free treatments, and they were also my guinea pigs as well. And my aunt, I've known her my entire life, and she's always been this very conservative lady. And I think it was after her third treatment, she came in the practice and she was wearing these skinny jeans. She had red lipstick. She was completely different to the person that I knew. And she was like, no, Zama, this is me. I've started to see, each time I look in the mirror, I recognize the person that I now see in the mirror, because before I used to always gravitate towards all these wrinkles and all these other things, which are mainly brought on by, sun damage and stress and all of those things. So once you start doing the treatments, once you start making those lifestyle changes, you start feeling more confident, and you start, feeling like, okay, you know what, I can wear those jeans, or I can do this, I can go out, I can, do all those things that you were restricting yourself from doing because you were worried about what somebody else would think about your skin, or what somebody else would think about your frown lines, etc. So it's not as superficial as people like to say it is. It really is not. There's a huge psychological benefit that I think we need to really make people understand more about. And men as well, like men love doing their skin. It's such a great, time off work, being a dad, all these other stresses that you normally have in life. You just get to have somebody who can take care of your skin and improve the health of your skin for a 30-minute treatment. And those benefits also obviously last for months and weeks and years if you're obviously consistent and you make sure that you're using the right type of daily products, and even the skin routine that you do daily. That's amazing me time, just enjoy 5 minutes to yourself while you cleanse your skin and moisturize and all of that. That's really great. I think that's a huge plus in sort of preparing yourself to go to sleep, because you've taken that time to just not think about everything else around you, and you're just doing something purely for yourself.
Yeah, I think I also share sentiments a lot, because I remember in high school, there were a lot of people with acne, and that affected their confidence a lot, whether it came to doing speeches, whether it came to even walking around and socializing with other people. It became the sort of a barrier where they would feel less confident, they'd feel left out. So I think that it does have like a massive impact on the young generation as they're growing up. And speaking about that generation and education, I want to find out, in terms of the educational path that you have to take to get to aesthetic medicine. I heard there was something about a 6-week course, and everyone is not too sure exactly what you have to do to get there. So if you could share a little bit about what educational path you need to follow to get there.
Okay, so education is key. In terms of educating yourself, and obviously also educating your patients. So it's very important that you go to a doctor who has taken certain courses and has taken time out to really learn about the skin, because generally with medical aesthetics, the majority of us are general practitioners and we are not specialists in skin. So we're not dermatologists. So as a GP, you would then, even as a dermatologist, because dermatologists as well have to learn about the aesthetics procedures that are done. So either as a GP or as a dermatologist, for example, or even as a plastic surgeon, you would have to go for specific training for aesthetics. So you learn about, skin and a lot of the very common skin conditions that people have concerns about. So acne, hyperpigmentation, skin aging, all of those different things. And then you also have to then understand what a peel is and what the different concentrations mean. And, obviously we always stress about understanding the complications and when not to do which procedure on or which skin treatments on which patients. So you'd go through training for all of that. Then you'd also go for training for specific procedures. So like Botox, or I don't like using the word Botox because Botox is actually a brand name like Coca-Cola, but it's the most common name that people, use. But I'd like to use the proper description, which is anti-wrinkle injections. So you'd go for training for how to give or how to do that procedure, and then when to do that procedure, how to assess the patients, etc. So there's a lot of different training programs that are available out there. The reason being, medical aesthetics is very new in South Africa. According to HPCSA, we actually don't have a specialization that is medical aesthetics. It's more that you're a GP with interest in medical aesthetics and not a specific speciality. So because of that, there's lots of people who are, offering training courses, and there's a lot of room still to grow for medical aesthetics as well, especially in South Africa, so that it's much more formalized and it's a bit more streamlined, where that everybody who does it goes via the same training program and it's very standardized and the quality is kept the same. Because like I mentioned, there's lots of different places, but they're not really teaching the same way. So it's very important that if you are interested in it, you do a lot of your research, especially talking to people already in the field and find out, which training program do you suggest I go to? Because I know there are diplomas. There's also other places that are more practical versus theory. So you have to basically choose and decide where you would feel like that's the better training program to go and be part of. But it's vital that if you go to somebody who offers medical aesthetics, they have gone for some sort of training. And more than that, they have experience as well. Because, as a medical student, first year, second year, reading all of those conditions versus now going to the hospital and applying, it's completely different. So experience is also very, very important as well when deciding, which doctor to go to for a procedure, especially for medical aesthetics, because if it's something on your face, you must definitely do your homework for that. Yeah.
So I wanted to find out in terms of the education, do you have to be a medical doctor to do aesthetics?
You have to be a medical doctor. However, like I mentioned before, it is new. So there aren't really set, protocols and rules and all of those different things about medical aesthetics. So unfortunately, you do find some other people who do medical aesthetics that shouldn't. So at the moment, you have to be a medical not a medical specialist, but you have to be a medical professional. Dentists can offer, medical doctors can offer medical aesthetics treatments. Then obviously doctors that have specialized in the other fields like in dermatology and also in plastics, they also can go for those courses. However, there are areas where you find somebody who is just a skin, somebody who does skin treatments can suddenly now start offering microneedling, or they can buy Botox and then start offering that as well. So it can be a little bit, iffy in some areas. That's why it's important for you to sort of know your limitations and then stick to what it is that you know and that you legally are supposed to be doing.
Yeah, see, the reason why I asked you that question is because I have come across people that are not medical doctors or not involved in the medical field that have become aesthetic medicine practitioners.
Yeah.
Now, the problem with that I feel is that if someone comes to you with a skin-related medical problem that should be seen by dermatology and not aesthetic medicine, they will not be able to tell the difference between what can be done in aesthetic medicine and what should actually be handled by dermatology. Now, in that situation, imagine going and taking an aesthetic medicine procedure, trying to apply it to a dermatological problem, and then something happens to the patient. It's a lot of legal problems and litigation and all of that sort of thing. So, yeah, I share the sentiments that I agree that you should have some preliminary medical education before you do medical aesthetics.
I mean, even for myself as well, at the end of the day, as much as I've done the aesthetics training and I'm confident in, the procedures that I do, and I know that I do procedures that are within my scope of practice, there are some times where patients would come and it's like, okay, you know what, as a doctor, this is beyond my level of expertise. I'd like to refer you to a dermatologist. And then once the dermatologist has treated the skin condition or whatever the reason is for sending the patient to them, maybe I'm comfortable just doing your Botox, or maybe I'm comfortable just doing your filler. But for this part or this aspect of your skin concerns, rather go to the dermatologist or rather go to the plastics. So I think at the same time, it's also very important to always be aware that it's a community as well. Like, don't sort of force yourself to doing things that are beyond you because now you advertise that you're a medical aesthetics practice. I think the patients will respect you more for that, for saying, listen, this is as far as my expertise goes. I'd like to refer you to a dermatologist. And you explain the reason why, or, what your concerns are, rather than tackling something that you honestly don't really know what it is that you're doing. But that goes back as well to the training. If you get proper training, you understand, these are the red flags. These are the patients where this is contraindicated for, or these are the patients that, are extreme high risk. So with that kind of a patient, you would then refer to somebody else. But if you haven't had adequate training or good quality training, you will always just, be a cowboy, and then do things that you shouldn't be doing because you don't really understand and know your limitations. And knowing your limitations is not a weakness, it's a strength, because then you also using the community aspect of medicine, because we always work in referrals. So make the patient understand that this is a system that we use and I'd like to refer to somebody else. However, for this, I'm comfortable doing it, and
I see. In terms of this field is constantly evolving all the time. And so what I want to find out is, how do you stay motivated and inspired? Because there's so many different things coming into aesthetic medicine. So how do you stay motivated and inspired to continue learning and continue sharpening your skills?
It's exactly that. It's the fact that it's always evolving. There's always something new. There's, oh, did you see so-and-so tried this and these are the results? So it's very exciting. It's a field that is constantly growing in terms of, the policies and the politics, the new procedures that we're able to do, the innovative, things that people are coming up with. It keeps you on your toes to a certain extent. Last year you were doing filler in this way. This year you're doing filler in this way, or there's a new type of filler that has these kinds of results. So it's a very dynamic field. And I think, especially for doctors, you constantly feel like there's room to grow. There's something new to learn, which is what we love. We love learning. We love, growing. And then you get to offer these new treatments to your patients, and the patients also get excited that, oh, okay, now we're doing something different. So
something new, you're staying updated.
Plus they're always on the ball because of the internet. TikTok.
That's true.
TikTok has made things difficult for us.
And they start asking you about stuff that's overseas. And then now you have to learn about it. And then I think that creates sort of an interesting dynamic in terms of the learning aspect. Because if someone comes with something new, and it's your job to try and do some research on that, can I offer that? Where are my limitations? Do I have the skill to offer that? And I agree with that. And speaking about, practicing, what is the most rewarding part of your job? I know you spoke about how patients respond to that in terms of their self-confidence.
Yeah.
But what else is rewarding for you about this particular part of medicine?
I think it's just basically that, because that's, one of the, I think we had a conversation about this last year about, you have to know in medicine what is your, like what
Excites you.
What excites you, yeah. And then when you're choosing whichever field you want to go to, you need to choose a field that's going to constantly give you that, because the last thing you want is to feel like your job is monotonous and not to have job satisfaction. Like you have to, because in medicine, whichever field you're going to go into, you can end up doing that job every single day for the next 35, 40 years of your life.
That's true, yeah.
So the job satisfaction for me is definitely the psychological aspect, and that's just my own selfish, reasons. Yeah. And also just the picture that I've created in my mind and then actually seeing it. So like when you assess the patient, you're like, oh, this is how your eyebrows are going to look after we're done. I get so excited when I see that actually, happening. Like, oh, I did it. Yeah.
And I believe that's also one of the reasons a lot of mature students end up coming into medicine. Because whatever field that they did go into, it doesn't light their skin on fire, so to speak.
No.
It doesn't excite them. And I think that's why they tried to come to medicine, because medicine is so vast and it's always changing. Yeah. And there's so many different specialties that there's something for everyone.
Yeah.
Even if you don't see it at the beginning, I know in the first few years, you're very confused. You don't feel like you're a doctor. You don't feel like you're doing medicine. What am I doing? I'm studying. I'm not really doing much. But then I think as you go into your clinical years, you start to see like, this is what medicine is about.
Yeah.
It's this wide variety of things. Everyone is working together. It's all interconnected. It's like a web of people just working together. And I think, that's very interesting, but it can also be challenging.
Yeah.
So in terms of that, what is the most challenging aspect of aesthetic medicine? What is the most challenging part of it?
The most challenging, it differs. For example, I think for me, it was the business aspect. In medicine, you know that if you know how to do your job, you will get the results. And then you go into private practice and you're like, okay, I know how to do this, so the patients will come because the results.
That's how it should work. I would hope.
It doesn't work like that. There's a huge business aspect to medical aesthetics. Actually, there's a huge business aspect to private practice generally. And I think that's where we really, really fall short. And we end up having really amazing doctors end up closing up their practices because they don't really understand marketing. They don't understand branding. They don't understand all these other business aspects of, private practice. And for me, it was a huge challenge to the point where I closed my practice. I had to shut my practice down because I was just it wasn't doing well. And I had to, sort of backtrack and think, okay, what did I do wrong? How did I? And also, again, stressing the community part. Speak to those people that are successful and ask, guys, how did you survive COVID? And the common thread when I was going and asking all of my colleagues that survived COVID was they had a proper business aspect really well taken care of in terms of their private practice, especially with medical aesthetics, because it's very seasonal as well. So you need to be able to make plans for that when, the patients aren't coming in. What else are you doing? Are you selling products? How are sales? How are you marketing the sales? All of those different things, because there's overheads that you have to, cover and all of these other things. So it's important to phone around, speak to your colleagues, speak to those people that have closed. Like, guys, what happened? Why did you close? Speak to those who have been open for 20 years. How did you manage to stay afloat, even though people were not, that interested in medical aesthetics? And then learn from their mistakes, learn from what they did well, and then, reapply it into your practice, how you see it would fit in your practice. So it was definitely that was the biggest challenge. And then also having to explain to patients that, yes, you've come in and this is what you want to do, but I actually want to do it this way. It's a bit difficult in the aspect that patients will look on TikTok, they'll see a before, they'll see an after, or they'll see a little bit of what was done to the patient. They want the after, but they don't really understand that to get there, I have to first start with maybe, doing Botox here, although you've come in wanting filler. So I think I had to learn how to really explain and articulate my thought process very well so that the patient stays trusting that the process is going to give them the end results. The end results might not look like what they want today, but it's a process. So I think that's also something that I found as a bit of a challenge, but it was a great challenge because then I think I'm a better doctor by learning how to navigate that, because now my patients trust me more, and I'm very, very open now about, listen, this is what we need to start off. I know you concentrating on your nose, but the way your nose looks is actually determined by your cheeks, which is weird when you say that to somebody because they thought you're going to do their nose. Then you start off doing their cheeks and then they see, oh, okay, no, I see there's an improvement. So yeah, I think that those two were the biggest challenges.
Yeah, you brought up the point about social media. I was going to ask you a question about it later on, but I think I should rather ask it now. How do you navigate the whole situation about social media? Because as you mentioned, there are a lot of before and afters, but a lot of the people lie in between. Like, how do you get from the before to the after? Because sometimes you'll watch a video and you'll see, okay, I definitely know this person did something surgically.
Yeah.
No matter what, it could have been Botox, it could have been filler, but this natural cream that I don't know where it came from is not going to take you from the before to the after. And then they go and tell their followers and all the people that are scrolling through TikTok and some of their other viewers, this is the before, this is what I use, and this is the after. And you can't really trust that kind of thing. And then like you mentioned, you have patients coming to you and showing you the before and the after, and I want this.
Yeah.
So in terms of navigating that, because you have to navigate it in terms of also affordability and accessibility.
Yeah.
This is what happens overseas. Do we even have the equipment, or do we even have the medications or whatever is required to do this? So how do you mentioned how you like show them, but how do you navigate like trying to change their mindset? Because it's a nationwide thing. It's not just like some of the patients you've seen.
Yeah.
Maybe a lot of the patients across the country, maybe they saw one of your videos. Oh, let me drop by. I'm here for business from Johannesburg and let me see what I can do.
Yeah. No, that's very true. I think it's educate. You have to educate your patients. I don't believe that as soon as somebody comes in, then you just start doing the procedure. No, you need to explain what it is, what it does specifically for them. So one, you always have to educate patients on what it is that you're doing, and also explain to them that I'm going to tailor it to you. So that also means that yes, you've brought me a before and after, but this person is different to you. You know, maybe the shape of your nose may be similar, but your cheeks are not the same, or, whatever it is. So it's important to make sure that you assess your patient while they're looking at themselves in the mirror as well, so that they can, it kind of goes back to that this is specifically you. I'm not doing the person that's in that before and after. Then the other thing is have your own before and afters. I think it's very good to have your own collection of, the work that you've done, where you can confidently say that I've taken somebody from this to this, versus, trusting or having a patient show you somebody else. Because yes, the before and after might look amazing, but like you mentioned, there may be something else that was done and not necessarily the skin product. Or there's a filter, or the lighting, because we understand that especially in medical aesthetics, where your light is, it's going to affect how the light hits your face, and it's going to affect how big your nose looks, or how your forehead looks bigger, all those different things. So it's very important that you also educate patients, not just on what you're going to potentially do, but also on, befores and afters. They can be influenced by artificial light. There's a difference between, artificial light and natural light, and how that makes our skin look. There's a difference between adding a filter and not adding a filter, even the type of cameras, even the distance that the pictures were taken. So there are all of those little details that make a huge impact on the before and afters. And you have to be honest with patients and say, I can see this is what you want. However, this is what we are going to do and this is how we do it. Then the other part to that question is also making sure that you educate the patients that it is a process. There is no way I am going to apply any products to your skin today and the acne that you have had for years is going to suddenly go away in like 3 months. Impossible. Like, pack your bags and leave. That is not the right person for you if that is what they're promising you. Because the other aspect is we understand acne, it's not just about taking care of your skin, but what are you eating? You know, your lifestyle as well. Are you very stressed? You know, there's so many other things that happen or other things that contribute to how healthy your skin is and what's happening with your skin that your doctor or the whoever that you're seeing for your skin concerns also brings up. And you can't just have somebody just looking at your skin. You have to also dive into that. What's happening? Have you noticed a pattern? Are you using the right type of material as your pillow? Is it the hair gel that you're using? Have you recently used new makeup and maybe you're having an allergic reaction? So it's very, 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 very tailored to you. And it must also be about not just looking at your skin, but actually properly assessing your lifestyle and all of those things. So educating the patients and making sure that they understand that it's a process that will help sort of, you know, not distract them, but make them not have that laser focus on a before and after that promises after 2 washes, this is how your skin will be. And they'll understand that, no, this is a process and I have to make certain sacrifices as well. Because I like drinking this cappuccino, but the milk does not agree with my skin, or I have flare-ups each time I use this type of milk, so I have to tweak it. Because that's the other thing that a lot of patients didn't understand, that you need to make changes so that your skin is healthier. Yeah.
So then again, you spoke about a diet and, you know, I want to bring in a bit about exercise and that kind of thing. What kind of foods should someone, generally speaking, avoid in terms of, you know, acne, for example? What kind of food should they avoid? What should they have more of?
It differs. And I always, like, my experience has taught me that you always have to tailor it to the individual.
So it's different for different people.
So for example, I have a patient who we started the skin treatments and there wasn't much of an improvement. And then we decided, okay, let's change the diet a bit. And the biggest difference was when they stopped eating red meat. And then somebody else, each time it was winter, she would go to her favorite coffee shop and they would make her favorite cappuccino. And it would be like, Zama, help me, what's going on? And we realized that, no, it's this milk in this cappuccino. So it's always different. It's different for everybody. And I think it's very important at the beginning to ask all of the questions, see the patterns, and then tailor it to everybody. Because I could say for you, don't eat red meat. Meanwhile, that's not the issue for you. It's the milk that you have with, you know, your tea or whatever. So it's always has to be tailored. And that's the other part that excites me about medical aesthetics, is that 2 patients with acne, same type of acne, etc., will never actually be treated the same way. You know, the skin products that you might choose to use are not going to be necessarily exactly the same. The lifestyle changes that you'll suggest are not necessarily going to be the same. So I think we also need to then have that sort of approach where it's like, okay, the individual in front of me, what are their red flags? And then, you know, tweak their diet, or, you know, advise them to sleep better and maybe use ashwagandha and relax and, you know, a bit of magnesium so that you actually sleep. And then you see, you know, improvements depending on what you advise.
I see. So speaking on that, again, we spoke about diet, and I want to talk about exercise. So I know exercise, you know, is a stress reliever, and it can also change the shape of your face if you're in better shape. And so those kind of things, how do you speak about that to someone who you can see that this procedure is not going to make that big of a difference? You'd rather go the lifestyle modification route. How do you change the patient's mindset from, okay, it needs to be done in terms of products, it needs to be done in terms of surgical procedure, as opposed to lifestyle modifications?
So it always differs. some people are more open, and you'll see, like, okay, this person, from the first consultation, we can talk about diet and changes, and they're happy to implement a few changes in their diet during the first or after the first consultation. With some patients, you would rather maybe say, okay, let's do some skin treatments, and then you'll see, okay, we've done 3 or 4. Yes, there's a difference, but I was expecting or anticipating more of a difference. Are you still, very stressed? Are you still eating, the way you were eating? Are you still not sleeping well? Okay, how about we start to introduce that? Because remember, you don't want to overwhelm somebody. The last thing you want is somebody to say, stop wearing glasses, quit wearing black, all the things that you are used to doing. It's hard. But if we stop with, okay, do you want like a brown top rather than black? You'll be a bit more willing to do that. Then, okay, actually, no, the brown suits your glasses, you're comfortable with it. Then as time goes by, hey, do you want to change this now? Or do you want to tweak? So I think it's also important to not sort of overload people, because now you're sort of substituting one stress with another.
Yeah.
So rather do it sort of in little bits here and then little bit there. And then it's also a nice way of allowing your patient to say, okay, I saw what the skin treatments did for me, but whoa, the skin treatments and a little bit of exercise, or the skin treatments and a little bit of dietary changes, my skin is so much better. My skin treatments, dietary changes, and supplements, So then it makes them, then you will be more trusting of the changes that I would suggest, because you've actually seen how each of those have changed. Exercise is very difficult to start.
Yeah.
I mean, if you're not somebody who wants to do it, then you're most likely not going to be able to. And I know a lot of doctors that offer, that do medical aesthetics and offer the weight loss treatments. It really is, it can be such a huge challenge, because a lot of people want something that works like that, especially when it comes to weight loss.
Yeah, I see that. And nowadays, what I've noticed is, if you can just speak on this, you spoke about weight loss. Liposuction is a huge thing nowadays. I've seen it a lot. It does help some patients in terms of managing the weight, because the weight and the extra fat has been built upon years and years and years. And a lot of patients don't want to be consistent with exercise. It's like either, I don't have time, but I think it comes to accessibility, and it comes down to convenience at the end of the day. Because I think nowadays everyone has this view that in order to be in good shape, I have to go to the gym, I have to be able to afford a gym membership, as opposed to saying, listen, I have a home, I have some empty space, I can buy a skipping rope, I can do some skipping, I can do some bodyweight exercises, I can start, instead of paying the whole year, every month, 500 Rand, end up paying 6 grand the whole year for a gym membership. I can start investing that into some better equipment, and I can improve that over time. I think that mindset hasn't reached a lot of people these days. And so what are your thoughts about that? About making it more convenient for yourself and trying to fit it into your lifestyle? Because, as a doctor, when you're on call, the next day you're tired.
And then you get post-call exhaustion.
And then you post-call, and then you have exhaustion, you want to sleep the whole day. And then the next day, you go, you've had enough sleep, you rested, you go the next day, you have a normal day, you come back. Do I really want to do some exercise right now?
No.
Do I really want to do some skipping? Should I do some weight exercises? So that kind of thing. How important is convenience in making it?
It's very hard. I mean, I'm just thinking about myself as well. Just not going to gym for maybe 4 weeks after having the flu. It's so hard to go back.
It is quite difficult.
The excuses are just at the tip of my tongue. I can just give them to you. But I think it's important for each individual then to sort of want it hard enough. And you can only do so much as the doctor. You can only say, listen, these are the benefits that I think you would have. And this is as far as I can help you. You can advise, obviously, listen, you can get a personal trainer, which costs money if you feel like you're not self-disciplined, or you can get an app, because there's lots of apps, or even just, Google. People will write sort of nice little exercises that you can do over an hour, and even create your little gym at home, like you mentioned. But it's very much about self. So unless the patient wants it, then they won't do it. I mean, if they want it bad enough, they'll do it. But if they don't, then unfortunately, your hands are tied. And I mean, we see that a lot in how many people love those injections that cause lipolysis, and how people really gravitate towards the liposuction and all of those different treatments because it's seen more as a quick fix. However, it's not a quick fix. You actually have to exercise even afterwards in order for you to maintain those results and to actually even improve those results. So the exercise factor will always follow you. You can't escape it, but it's just an individual's decision to see when they see it fit. Because even with dietary changes as well, I mean, you can't exercise and still eat the kind of food that you were eating before. Like it's more 80% what you eat and 20% what you put in at the gym. So it definitely has a huge factor. And for some patients, I would say, oh, you know, we can't really do, fillers around here because at the moment your BMI is a bit higher and maybe you've started an exercise regime and you are going to lose weight. So your cheeks are going to change because remember, we've got all these fat pads on our faces. So if you somebody who's starting to, exercise, I'd rather say then wait and see how your face changes as you lose the weight or as you start with the exercising. Then the other factor with exercise is people that love to do road running. You need to have a proper skin routine. You need to use sunscreen because a lot of those patients, they lose a lot of fat in their faces and the skin starts to sag a lot. And a lot of those patients also end up suffering from hyperpigmentation and all of these early signs of aging because of exposure to the sun. So there's also that as well. So for example, people that run the comrades, I'll have a lot of patients that will want to come and, sort out their skin after they've done the comrades because they're not going to be training as much. And, because a lot of the treatments that we do, you usually have to, not exercise or not do any, manual labor. That's quite a lot for maybe 24 to 48 hours. So if you have somebody who's very active, you also have to make sure that you place their treatment at a time that's going to be convenient and that won't hinder their training sessions or that's not going to be negatively affected by their training sessions as well. Because you can't do a skin treatment like a peel today and then tomorrow you're running at 2:00 and blazing sun. It's just going to cause more harm than anything else. So it's a little bit of both. You promote exercise always because it helps with stress, and stress is a huge factor. But at the same time, make sure that people are aware of what types of training can affect their skin. So for example, the example I gave you with the road running, and then also with body contouring, it's very important that patients understand that you have to exercise. You can't run away from it. Even if you've had the liposuction, you need to then exercise because you'll hear stories about people getting their second, third, even BBLs. People will have a second, a third, a fourth to maintain. It's not to maintain, but it's because they didn't make the necessary lifestyle changes, didn't exercise, didn't change their diet, and the fat starts to sit in other areas that they're not comfortable with. So it always goes back to educate. And then unfortunately, it's the patient who makes the ultimate decision. But as long as you have educated and explained what the benefits of training or exercise would be.
Yeah, I see. And, I think there needs to be a line that needs to be drawn between what is a catalyst and then once people start seeing that, oh, the catalyst is working, it becomes now a shortcut.
Yeah.
And so that is what you were speaking about. Like someone will continuously come back for the lipolysis strip, for liposuction, continuous implants to try to maintain. And I think that once someone gets a taste of what the shortcut is like, all of that consistency on to keep up with my exercise starts going away. And I think, as you said, education is the most important thing.
Yeah.
And I think people need to start choosing the harder path, because generally the easiest path is generally not the best way, I would say.
Just a few hours under the anesthetic, and then I come out and my body's no, I want that.
That's
no, but I hear what
bit,
you're saying. Yeah, definitely. I mean,
That's true.
6 months of vigorous exercise versus 3 hours on the table.
Exactly. You have to weigh that out, I guess.
Yeah, true.
And speaking about affordability, can good skincare be affordable? Because I think a lot of people believe that, okay, I need to spend a lot of money. I need to be earning a lot of money to have a good skincare routine and to have great skin. So how does that come in terms of cost?
Yes, you can have great skincare with a tight budget, because it starts with, one, understanding your skin. So what is your skin type? Then when you go to Clicks, you choose the right cleanser for your skin type. You choose the right moisturizer. You wear sunscreen every single day and reapply it every 3 hours. Just those little steps, just having that skin routine with those little steps can improve how your skin feels, how your skin looks, and obviously the general health of your skin. So it's never that you have to swipe 10,000 Rand for you to really have great skin. It's about understanding the type of skin you have, choosing the right products for your skin, and then also being honest about your lifestyle. I think we can't run away from the lifestyle aspect of it. Like if you have a lunch bar in your bag every day, then, those nuts, the chocolate is going to affect your skin. So you need to rather have, a fruit, or rather, substitute it for something that will not increase your blood sugar content. Because obviously we understand that aspect as well as doctors, that if you eat a lot of sugar and you're not drinking enough water and you're very stressed and all of those things, it can cause you pimples, even if you're somebody who doesn't have acne prone skin. So you have to be very realistic about what it is that you put in your mouth. And definitely.
Yeah, I see that. And are there any details or experiences you can share about a transformative case that you've seen has had a massive impact on a patient's life? I know you mentioned your aunt, but are there any other massive cases that you can speak about?
I've also enjoyed the transformation that I had on a male patient, and for him it was his chin. And when I first assessed him, he mentioned that he always makes sure that he has a beard, because he was very self-conscious from even when he was a teenager about how his lower how his lower face is shaped. And so we then did a filler. I added filler in his chin and added filler on his jawline as well. And that was, that was so much fun to see. And again, it wasn't, on the table at 9 we start and then finished at 3. It was a gradual thing. So I think I did about 4 sessions with him, gradually sort of adding filler here, adding filler there, giving it time to settle, and then him coming back and then adding some more. And the change in him, like how he became more confident and how he really loved the results, and you could it was amazing to see. Yeah, that has been one of my favorite results to see as well. And the fact that a lot of men have beards, not because they love having beards, but a lot of them it's to cover, for example, acne scarring. Some men will have beards to obviously cover when they feel very self-conscious about their very short chins and things like that. So that was a great lesson for me as well, to learn that, okay, people will be aware of certain things about themselves and then they'll compensate in a certain way. So that was quite interesting to learn. And the results were really great.
And what's funny about that is that you say majority of your you have female patients, but this was a male patient that had the massive impact on. It's great to hear.
Yeah, definitely. Especially because people always think filler and things like Botox, it's more for females, and you can make the face more masculine using filler, different types of filler, depending on which areas you want to inject. So that was also quite a nice thing for me to be able to do, and then post to show people that, listen, it's not just females, but males as well. And it's not just skin treatments that, can make you feel more confident, but things like filler as well, because especially in our community, people are very scared of filler. They think, oh no, you want me to look like, certain celebrities or, and it depends, because we're not the same as doctors. Our techniques are not the same. The kind of results that we're able to do are not the same. And I'm very pro being conservative. I think the best thing that I always ask my patients is, listen, I want you to tell me if somebody says that they can see that you've done filler. That's like the challenge for myself. Like, I want somebody to compliment you and say, wow, you look great, but they can't really put their finger on it. That is the kind of results that, excite me, because then that means that it's not an unnatural result. You still look like yourself, but just a little bit more. Yeah.
I see.
Yeah. So that's definitely a result that I loved.
Don't forget to like, share, and subscribe to the Afrimed Podcast. Sort of, Zama, how do you address the issue of addiction to aesthetic procedures? I know you spoke about, people wanting to take the shortcut a lot. So how do you deal with that in a patient that's coming back continuously? I want this procedure, do it again. How do you deal with that?
It's a huge problem. And I think it's very important that one, you educate your patient about that there's always the risk of possibly becoming addicted, especially when you start to see red flags, because certain patients, you'll notice certain things about them that might sort of make you worried about that. So if you do encounter somebody who's like that, it's very important from the very beginning for you to set very clear boundaries about, this is what I do, this is as far as I'll be able to go, based on my knowledge and understanding of the risks and also of what the procedure entails. And I would advise you to only do it to a certain extent, or to do it up until, the second or the third time, or whatever it is that, you worried about with the patient. But that comes with you communicating that at the very beginning, and making sure that you educate the patient about the normal process of a certain procedure. Like, this is how long the results should take. This is how many sessions we would need for, certain results. And specifically for you, because it always goes back to tailoring, specifically for you, this is what we would do. But having clear boundaries in terms of what you're willing to do is very, very important. And I have come across that, where a patient will come and they say, listen, I've done this many mils of filler, and I think that, I feel like I need more on my lips. And for me, the main thing is, one, the results must look natural, but more than that, I must not do any harm. And if you know that if you add more volume, you could possibly cause migration to, certain areas where the lips shouldn't have filler, and that's going to obviously look, abnormal. It's not going to look natural. So I think it's very important that you have very clear boundaries, that for your safety and for the kind of results that I, as a medical aesthetics doctor, this is, what I can offer you. And beyond that, unfortunately, I can't. And I mean, there are medical legal implications as well that you need to be very aware of. Should you, add more filler, because at the end of the day, the patient can't really be telling you what to do. You're the one who knows and understands the risks. You're the one who understands what this product is and what this product can do in the body, or what happens to this product in the body. So I think we need to also sort of take the responsibility as doctors to say, yes, the patient may want this, but I have a very strong stance against XYZ, or against going beyond certain things, and not necessarily blame patients. Because I notice a lot on social media, people say, when people do those big boobs or those big lips, oh, it was the patient. But it can't be the patient's fault. It can't be the patient's responsibility to sort of think those duck lips over time are not going to look good, or those duck lips over time are putting, my lips and how they move and all of those things at risk. It has to be us that are clear about that. So yeah, that's definitely how you should handle that.
And I think that ties into also the balance between natural beauty and an enhanced look that you see a lot in celebrities. Now, how do you approach a patient that is coming to you with a picture and saying, this is who I want to look like? And you will know as an aesthetic medicine practitioner that this is an enhanced look. This is after the light, as you mentioned earlier, the right lighting is done, the right makeup is put on. This is not the person's original complexion. This is an enhanced picture. And you want to take your natural beauty that you have currently and take it to that level. How do you advise them? Because as you mentioned, you want it to look as natural as possible, but they expect it to look like a celebrity, for example. So how do you...
So education. I start off, or I would advise other doctors as well, just start off by explaining to patients what natural, I'll use the example of lips because I think that's the biggest one, is these are the different parts of your lips. Your lips have different parts of them, and if you touch them, they feel different for a certain reason. So if I do a procedure, the lips or the different areas of your lips should still feel different. Like the border of your lips should still feel different to the inner part of your lips. The border should look different to the inner part of your lips. That's what we should aim for if we're aiming for natural. So that's what I always start off by doing. I'll have a picture of just normal lips, and then I'll educate my patient on this is the border of the lips, this is the inner part of the lips, and then touch your lips, and then that kind of gives somebody the perspective of, okay, so this is my natural lip and I just want it to be a little bit of a bigger volume. So this is the area where we're going to inject so that I still maintain the shape of my lips, but a little bit more volume. Or this is where we're going to inject so that we change the shape of the lips, but we kind of maintain the volume. So it's always understanding exactly what is it that your patient looks in the mirror and to them is a concern. And I think it always starts with looking at just natural lips and then using their lips then to say, okay, so what are you looking for with your lips? And then I'll explain, okay, so because it's this area or we want to add volume, this is the safer or this is the best, more natural type of filler that we can use for your lips. And then we would opt for that. The other thing is knowing what we as doctors know about how the filler works in the body. For example, the filler basically attracts water, and that's how you get that plump effect. If you understand that as a doctor, you're not going to then inject a whole mil at the same time or 2 mils, because you know that there's going to be even more plump or an even more exaggerated plump effect with the swelling from doing the procedure, but also that water that's now going to be in that area. So you can't then say, oh, but the patient was willing to do 2 mils or the patient wanted to. How can you do that when now I'm sitting here with lips that are like duck lips and humongous and I'm not happy? But you're the one who said to me, oh, no, we can do it. But you had that knowledge that there's going to be an even more swelling because that's how the filler works. So it's scary that we see those kinds of results with patients, but we can't keep blaming patients. You have to keep educating. So educate on what the filler is or whatever the product is and how it works. Then also educating the patient specifically for them, that to get natural results, this is where we should inject, this is what we should inject with, and this is how we should inject. So some patients I'd be comfortable with doing 0.5 mils or 0.8 mils in one sitting. Other patients, based on what you've assessed, you'll do it over a period of maybe 2 or 3 sessions. So it's always based on the patient's history and, are they high risk of swelling or all of those other things. So it's never going to be the same. 2 people can come in, 2 besties can come in and they'll be like, we both want filler, but you're going to do it completely differently for both of them because their bodies are not the same, their lips are not the same, and their wants and their needs are not the same. And the other thing is we don't want to contribute to what has made a lot of people very wary or scared of doing medical aesthetics procedures. It's those kinds of results that make people think, oh, these doctors don't know what they're doing. They make people, have these duck lips, or people come out with foreheads that don't move at all. You don't see if somebody's angry at you or happy or whatever because they just have this frozen face. So I think in also changing the negative perception that a lot of people have about medical aesthetics, we as the medical aesthetics doctors or doctors that practice medical aesthetics, we have to also show people that you can have natural results where you can still move your forehead, but you've had Botox and you no longer have the lines that you're worried about. Yes, you can do a lip filler and have plumper lips and nobody can see, like, while you're turning the corner, somebody can already see these lips before the rest of your face even appears. You can have natural looking lips that are more plump. Natural for me is always my aim. And I think patients that want that gravitate towards me. Of course, there are patients who actually want those big, thick lips that don't really have, a shape. That's fine, but that's not necessarily what I choose to do or I offer. There's somebody who can do that. So I think it's also important for you to be clear as a doctor what it is that you're willing to do and what it is you're not willing to do.
Yeah. And I believe, like you spoke about, education. I think the greatest effect is combining education and demonstration in terms of showing a patient, hey, like you mentioned, this is the anatomy of the lips.
Yeah.
And so this is what I'm going to be doing. And I think that's very important because we've all been to general practitioners for the flu, for example, or for any other kind of medical condition. And I feel that the best doctors that I've been to were the ones that said, here, this is the anatomy of the face. Okay. And this is what, your turbinates, for example, look like.
Yeah.
And this is what's happening.
Yeah.
There's a post-nasal drip. It's going back. It's going into your throat. And as you are speaking, there's abrasions in your throat and it's colonizing that. And that's how the infection is starting. So now from that, I know, okay, this doctor knows what he's talking about. He's not just telling me, do X, Y, and Z. Take this, take that, take it so many times per day. They're making me more educated.
Yeah.
So I know in future, okay, I understand this. So I think that's one of the most important things in any specialty in medicine.
Yeah.
Whether it be aesthetics, dermatology, internal medicine. Because generally you'd come across a patient, you ask them, do you know that you've been for this procedure?
No,
I don't know what it means.
Scary.
I don't know what it means. I don't know what it is.
Yeah.
And that has an impact on patient outcomes.
True.
True. And, tying into that, talking about outcomes, when patients come to you with the topic of aging, anti-aging, like you mentioned earlier about the wrinkles and that kind of thing.
Yeah.
How do you take them through that approach? Because it's very difficult to take someone who's coming in at 55 and says, I want to look like the 25-year-old, for example.
Yeah.
How do you explain to them that, it's a natural process, but we can do, a few things to help you age better? How do you approach that?
Yeah, aging is a bit of a sticky one. I know that a lot of people don't like that word, anti-aging. Anti-aging has got a lot of bad connotations because it's as if you're saying, oh, people mustn't look 40 or people mustn't look 50 or 50-year-old must look 30. That's actually not what the message is. It's more about improving premature signs of aging. And the premature signs of aging are caused by things like stress, caused by using the wrong products that can, really be too strong for your skin and can cause burning and all of these other things. And then you end up having skin that's thin and very wrinkled, not because that's how your skin naturally is, but because of these products that you're using. Then also, obviously, sun exposure. A lot of people don't really use sunscreen, and then they end up having, these sunspots, and they end up having, wrinkles and all of these other premature signs of aging. So anti-aging is not about having a 50-year-old looking 20 or 30. It's about a 50-year-old looking and feeling like a 50-year-old. That's what it basically is about, from my understanding, and based on what it is that I offer and the treatments that I do. So first of all, it's always about improving the health of your skin. Once your skin is healthy, it's going to look its age. Then you can obviously add things like Botox and filler, etc. If you've noticed that you've lost quite a lot of fat pads in your face due to aging, and you just want to have a little bit more of a lift in your face, then we can obviously add a little bit here and a little bit there. And then, of course, with the Botox or the anti-wrinkle injections, then we can obviously add some as well. So you don't necessarily suddenly have this new face where your family members can't even recognize you. And they're like, I think no, not at all. It's you, but you just look like you've had an amazing 3-month holiday, or, you've just
finally had a good night's sleep.
Yes, exactly. So I definitely understand where people are coming from, because with anti-aging, we've seen some scary looking procedures that are done, all around the world for, patients that don't want to age at all. But like I said before, there's always a doctor who's willing to do that thing that you want, if you want to do it. But I think each of us have our own expectations of what kind of work or results I expect for myself. And like I mentioned before, it's always more natural. But yeah, I definitely understand where people are coming from, because with anti-aging, we've seen quite scary results from those scary procedures, but it can be done in a very tasteful manner. And as long as you're also very educated about what it is in your lifestyle that's causing you to have these premature signs of aging, because we don't just put a plaster over it, you need to actually treat the cause. So are you sleeping well? Are you eating well? Are you exercising? If that's probably something that you need to start doing. Is your thyroid or your thyroid hormones under control? Is your blood sugar under control? All of those other factors that are very important in terms of lifestyle that can also improve, those premature signs of aging are vital to treat and to overcome as well.
Yeah. And speaking about, ethics and certain doctors skating the line of ethics, so to speak, I think I wanted to cover that topic, actually, psychological and ethical considerations.
Right.
How important is the psychological assessment of a patient? Because many patients may have body dysmorphia, in fact, a psychological condition. And so, whereas certain doctors may take advantage of that, okay, this patient has body dysmorphia, that means I'm going to get multiple consultations from this patient. They're going to pay for every procedure that I want to do. So how important is the psychological assessment of a patient?
It's very important. It's with every single consultation that you do, technically you are doing a bit of an assessment. There will be patients, like I mentioned before, when you were asking me about, when's the limit? When do we say, okay, this is enough? There are patients where you'll encounter and there'll be red flags. It might be initially an orange flag during the first assessment. Then maybe when they come back for the second treatment, certain things that they'll say, or, while you're assessing certain things that you'll see, then they'll change from orange to red flags. Then you obviously have to make sure that you refer, because remember, we are a community. And you don't want to sit with a patient that you are not able to adequately assess and not adequately treat. So if you are worried about that, there's always psychologists that you can refer to. There's, psychologists as well. If they feel like there's something, even beyond their scope, they can refer to a psychiatrist, etc. But we are a huge medical community, and referral system is always available for you to use, and it's very important before you even start doing procedures. If you're worried about the patient, rather send them down that route And then once the patient has been seen and, the psychologist or the psychiatrist is happy, then you can start, with the procedures. But it's important for you to know where your limit is, that this is now someone that I'm concerned about and I'm not able to treat or assess, then refer. But it's a huge problem. Some patients are able to hide it very easily. That's also very important for us to recognize. And once you get some sort of like your spidey senses start tingling, then definitely put the needle down and refer the patient. Otherwise, you keep doing procedures that are never going to satisfy the patient. And some people are looking for an after picture that literally does not exist.
Exactly.
Yeah.
Exactly.
And it's a huge issue because there's a financial factor. You don't know if they've budgeted. Are you spending money that you really can't afford because you're chasing after that? And I'm now going to be,
feeding that.
Yeah. So it's very important that speak to other colleagues that do medical aesthetics. Listen, there's a patient that I have, and this is how they're reacting. Should I be concerned? I've got a really great WhatsApp group with medical aesthetic doctors from all around the country. Yeah. And you're able to just send a WhatsApp and be like, guys, I'm stuck. I have a problem. I'm worried, things like that, because you'll never know it all. You won't know it all. So it's really good for you to have other professionals that you can go to and say, I'm stuck. I don't know what to do. What would you guys advise? What do you guys think? And then go from there.
Yeah, no, it's very important because you spoke about the value of community earlier in the podcast. And I was just thinking about that. Mm-hmm. I feel like a lot of the other specialties, because of the egos and maybe, competition in terms of filling positions, for example, that this collaboration doesn't really exist. Whereas you guys in aesthetic medicine, you guys are all in the same boat. You have your private practices and you're all trying to get advice from each other. And I feel that this needs to be applicable in all medical specialties. Because if you have someone who has many, many years of experience, that's maybe in Johannesburg, you can't really get contact with them if you're here in Durban, for example, unless a platform has been created for you to do so. And, I think that is very important.
Yeah. No, props to those doctors that took that initiative to actually first recognize that is something that's needed and to actually start that platform, because it really does benefit a lot of us. When we're starting out, you've got no idea what to do. And I mean, that was my experience as well. I remember I went for training. I did training with MedSkills, and one of the doctors was like, oh, when are you thinking of starting your practice? And I told him, and he was like, no, come to my practice. Next time you come for training, spend like 2 days or 3 days and see how I work. And that was amazing because it gave me like a very realistic view of what day-to-day is in a medical aesthetics practice, what it is that I need. Do I get somebody to assist me at the beginning, or am I going to be able to do the work, as I start? I mean, from the start, just by myself. Do I need certain machines, or am I fine just working with the Botox and the skin treatments and the filler? How do I build my practice? All of those, it might seem small things, but really huge things in the bigger scheme. So it's true. You definitely need to have that support. And it's really great when you have people that have been in the game for longer time than you, who are always available and say, you know what, if you need time or you need advice or whatever, I'm available. Then you do the same to others as well, even though you're not at that level yet. But just saying to somebody, hey, watch out for that. I fell into that pothole. Just take a left.
Around.
Yeah, go around. It really does make a big difference and it helps. So I definitely agree with you that the other fields in medicine would also benefit, and I'm sure they definitely do, but not all of them. But yeah, it's a huge benefit.
And I also want to find out, how important is it to involve the family in terms of consultations? Because a lot of people may have maybe unhealthy obsessions about their appearance. For example, the whole body dysmorphia conversation. And, sometimes the patient, like you said, may hide it, may not be able to reveal that. But some patients, parents will be able to say, yep, their child is acting very different now. Maybe after they watched this movie, saw this picture, met this celebrity, their view has changed. Now they're, not concerned with anything else in life besides this. So how important do you think it is to involve the family in these kind of decision-making processes?
It's a bit of a tough one because most of the time we see, not even most, actually most of the time, because for skin we can see teenagers as well, but most of the time you see patients that are of an age where they can consent to their own procedures being done. So typically that you won't have somebody coming in with a family member. They might come with a friend and they're both coming to do something, or they'll just come by themselves. That's where I think once you refer to a psychologist or psychiatrist or whoever fits the need for the patient, then they would obviously speak to family. But it would usually just be the patient on their own. But they are always red flags. Even while you're doing the assessment, you can hear how somebody speaks when they're looking at themselves in the mirror. Because I'll always give somebody a mirror and say, okay, you tell me, looking in the mirror, like, where are your concerns? There's certain words that people say, certain mannerisms that you'll pick up that, okay, we need to talk a little bit more about what your expectations are. We need to sort of understand what you understand about the process and being realistic based on what it is that we are working with from the start and where you want us to go. And then, it's usually like that. So I haven't encountered anybody where I've sat with family and I've had family sort of give me extra information. I'm sure that's happened with other practices, or other doctors have experienced that in their practices. But for me, it's just been based on what people say during the consultation with me, where I'd say, maybe let's not start with the filler, let's start with skin, and then start seeing how they talk about themselves as the skin improves, or they're fixated on that one thing that they really want to change.
Yeah, I see. And I think what I would like to move on to is, some trends in technology. So I know you have this WhatsApp group with other aesthetic medicine doctors, and you follow various accounts on social media and seeing what's happening overseas. Are those the only mediums that you get information about the latest advancements in aesthetic medicine technologies and those kind of things?
No, we're very lucky in that a lot of the suppliers, they're obviously the ones that have the products, and their products are always being changed and upgraded and all of that stuff. So they'll always offer training, so that once you start using the product, you've actually had training from their reps, and you're able to use the products better, and you're able to get, the best results from the product. So that's also another exciting aspect of it, is that you don't just have the training courses that are available from other doctors and other training programs, but you also have training that you get from the suppliers and the reps of the different products, and you're able to test and sometimes use yourself as a guinea pig with those different products, which can be quite a lot of fun. And then of course social media, big time. You're able to see and then research certain things or certain trends, unfortunately. And I say the word trends, and then I say unfortunately because a lot of trends are not very sustainable. They're not, procedures that you can do that have long-term benefits. So it's also important for you to sort of distinguish. For example, going back to lip fillers, there was a certain technique in how to do the lip fillers so that they're a bit more plump. But over time, because filler migrates, and we started to notice that patients actually don't have really good shaped lips after 5 years or 2 years or however long. And remember, you don't just use your lips to do a duck face for Instagram pics, but you also use your lips to eat and to talk and to do all of those things. And if over time those things are affected negatively by the filler, then that's a problem. So it's also very important for you to sort of recognize things that, okay, this is more of a trend versus this is something that's definitely going to be beneficial for my patients long term, and it's worth me investing my time and money in, getting training for it and then adding it to my treatments. Yeah.
100%. And the world is changing at the moment. Everything is moving towards artificial intelligence and that kind of thing. What role do you think artificial intelligence and 3D imaging is going to play in aesthetic medicine?
Wow. There's it's a whole playground.
Yeah.
There's so much potential that can happen, like so much. So much. And it will be very exciting to see what people come up with, because just my little brain, sort of thinking about what could be done excites me. So I can only imagine what, all the different product ranges, how they can change, all the different machines that we have out there, how they can change, and also how we consult. And how we, maybe there'll come a time where you don't have to have a patient give you somebody else's before and after. You can literally do their before and after and say, if I put this much here, like for example, if I put this much filler in your chin and this much, then you actually get that image.
This is what it's going to look like.
Exactly. And they know exactly what they're going to look like. They make a decision based on that exact result.
Exactly. So I think it also plays a role in diagnostics. So being able to determine how much sun damage, for example, a patient has had, how much product is required, what kind of timeline is the patient looking at? Because you being able to tell the patient, it could possibly be sorted out in a month or two, is better than there being, a patient worrying about, when is it going to get sorted out? We don't know if it's going to work and that kind of thing. So I think that's also very important. And what do you think? Like, I know we spoke about, artificial intelligence. Is there any other things that you think is going to become the future of aesthetic medicine? Do you want to be the creator of anything? Is there anything that you're going to be the pioneer for?
I have my own little ones, but I mean, really, there's always somebody who's thinking of the same idea that you have. Exactly. A little bit different, but always somebody thinking of the same, because all the ideas are based on what challenges we face, and we all face similar challenges. So I think it would be very interesting to see what innovative ideas and new procedures and ways of doing things come out of South Africa. I think that would be exciting to see come out of Durban, specifically from my practice. But it would definitely be interesting to see what we come up with, because a lot of the product ranges that we have and treatment options that we have and machines are from overseas and based on research done on patients from overseas, which have different skin issues than what we have, and also have slightly different skin, and their skin responds differently to some of the lasers and some of the treatments that we do as well. So it would be very interesting to see what we come up with from South Africa.
So in terms of genetics, now, different products respond differently to different people. And so how important is genetics, and how do you explain genetics to a patient, for example? We have probably have many people watching this podcast, and you have to explain that, at the end of the day, it does also depend on your genetics, how long it will take, whether it will respond. So how do you educate on that aspect particularly?
Yeah, no, that's a big one. You have to be honest. You can't give people false promises and, false hope, and, everybody's skin is different. And even if I have the same type of acne as somebody else, I might need another type of product, or I might need extra lifestyle changes because of my genetics. So it's always important that you tailor. I think it goes back to that you tailor your treatment plan to that specific person, because during the first consultation, you do a proper extensive consultation. I think that's the main thing that covers a lot of the topics that we spoke about, so that you don't miss anything, is that your initial consultation should cover a lot of things about lifestyle, family history, all of those different things. Because as much as you just treating the skin, or you just having somebody come in for contouring treatment, the products that you use or the treatment that you use is going to be going into their body. So you have to know and understand this specific person's body and how it might respond to what it is that you're giving them. So I think it's important that the initial consultation be a very in-depth consultation. It'll save you from missing a lot of potential issues that you might have. And then it's going to be able to give you more of a realistic picture in terms of what needs to be done for the patient, so that they move forward in getting the kind of results that they want. Because now you know what the risk factors are, what challenges are there in terms of their diet, family history, and all of those different things. Because there's a lot that you have to do sometimes with one patient that'll get you those results. And it's not just doing a few skin treatments, but it can involve them changing how they eat and, sleep and all of those different things. And there've been many times where I've referred patients back to their GPs for further medical intervention based on their family history, or based on, what we found during the consultation. And all of those changes were ultimately going to benefit their skin. But I think it's also, I want to use the word, but I don't want to use the word, but I'll use it. It's about wellness. I think a lot of medical aesthetics, not even medical aesthetics, medicine in general, you never treat a disease or a skin concern you're treating a whole human being. So there's the, psychological aspect, there's the emotional aspect, there's so much that makes up a person. So I think it's important to always go back to that as well with your consultation. Am I getting a clear picture of this person as a whole? And with my treatment plan, is it going to be able to treat this person as a whole? I think it's very important to do that, so that you're able to understand the genetics that they have, and they feel more comfortable with you saying, oh no, I'm a bit worried about us doing microneedling because you've got this history, then they understand, oh, okay, I'm safe. This doctor understands that there's a risk because I've mentioned XYZ, so we're not going to do it for now, or I'm going to have to go on certain treatments so that my risk is less. So yeah, I think it's very important to do a really good, thorough initial consultation with your patient and have a proper picture of who and what it is that they'll need.
Yeah. And in terms of all of this, you speaking about tailoring it to a particular patient, I want to know your opinion on this. I've come across a lot of patients that they may have had acne, for example, and they'll go to either a general practitioner or dermatologist. And, we've done a bit of dermatology. We've seen, the first things you need to stage it. You need to see, are there other things besides a tablet that can solve this? And I think I've seen a lot of cases, the first thing that they prescribe is Roaccutane. Everyone gets Roaccutane. It's the first step. There's no change in terms of skincare. There's no, okay, let me maybe start you on a bit of antibiotics to see if it responds for stage 2 mild acne, for example. What is your opinion on that? Like the first line currently in this day and age, everyone is getting Roaccutane.
It's difficult for me to speak on behalf of anybody else, but from my experience and what I usually do is I've noticed that it's a lot of patients actually want to be touched. Like a lot of patients want some sort of a skin treatment along with the acne treatment. So I don't want to speak about, how other people do in their practices, but that's always incorporated. And obviously a skin routine is a must, obviously, or a skin routine that considers what the effects of the vitamin A tablets are going to have on the skin ultimately. So you don't want to cause further damage to the skin. But I think it's very important to understand what it is that the patient also wants, because some people are happy with that. Like, oh my gosh, just a tablet, I'm cool with that.
Yeah.
Other people actually want to have some sort of a skin, just cleanse my skin, or do a treatment that's going to help with the dryness or whatever. So it differs with everybody. But for myself, I always have a skin treatment that is available, always based on what your skin needs today. Like, is your skin super dry because the vitamin A is thinning it? Is it very sensitive? Then we'll do something that's not going to cause further harm, but is going to soothe the skin further so that you don't have that issue. But I definitely have heard a lot of people complaining about that. And it differs with everybody. For some doctors, it definitely works well for them. And for others, they've added skin treatments because that is something that patients have requested or do sometimes require. So it's yeah.
I see.
Yeah.
And I want to ask you, how do you handle the pressure of maintaining your own appearance as an aesthetic medicine doctor?
When I have a pimple, I'm joking. No, of course it's important because people will look at you and be like, wait, but her hairline, she can't help you with my hair, her hairline. There is that pressure, but I think it's exciting pressure for me because I love being a guinea pig for the product range that I use and the treatments that I use, because a lot of them excite me and I see benefits in them. And, if I don't have any risk factors, then I'm definitely cool to do them. And it's also quite a nice thing as well when you able to explain to somebody what it is they're going to feel, because you know exactly what the micro needling feels like because you do it as well as the downtime. You're able to explain things like that better because you've experienced them. So I think it's very important as somebody in medical aesthetics to actually do the procedures and experience them for yourself. Not only because you trust the product ranges that you have and the treatments that you have, but also so that you're able to better explain things to patients because you've experienced them and you know those added, things that are part of the whole experience. Yeah, but there is a pressure, which is not bad because that means that I always have to look in my little tool bag and do all the different things on my skin. And when I find a combination of products that I like or that work well for an issue that I have, then I also sometimes incorporate it into the patient's routine as well. So it's always research. Okay,
yes,
always doing research. Yeah.
What are some of the common misconceptions that currently exist in aesthetic medicine that that you maybe like to clear up?
That we want everybody to look like aliens or or very unnatural. That's not the case. There are trends. We have to be honest. There are certain trends and there are people who really, really like those trends. And they do go to places where they're able to give them those results that mimic those trends. But at the same time as well, you can definitely have natural results that are very subtle as well, and do the injectables, And another misconception is that you're very superficial if you do skin treatments. And I think that is one that we need to really throw out the window because it's part of taking care of yourself. And I think people really need to experience it to really understand it, because I keep stressing it, but the psychological benefits are immeasurable. You really cannot imagine how that boost of confidence changes your life. I mean, people take risks that they would have never took before. And I think unless you've actually been in somebody else's shoes, I don't think it's right to make decisions or to actually have negative opinions on decisions that they make based on what they want to do with their skin or their face, because, they might have had, a really hard time with their insecurities and, that stopped them from really being themselves fully. And even in their careers, they started to limit themselves because of that low self-esteem. So yeah, I think that's the biggest one.
I see. Mm-hmm. And I guess, Dr. Ndlovu, my final question is, How do you want to be remembered as a medical practitioner?
I'd like to be remembered as as a medical practitioner who used her skills to, better somebody's quality of life. Yeah, whether it was from a consultation that we had and you felt, better from that one consultation that we had, and you felt more empowered from that knowledge that I imparted, and, what you told me, and us sort of coming up with a potential plan, even if I didn't do your skin treatment or even if I didn't do your Botox and filler, but just as long as I was able to take my understanding and knowledge of medicine and impart that, and you felt more empowered and made a better decision for your skin health, that's good. Yeah.
Thank you so much, Dr. Ndlovu, for coming on the Afrimed Podcast. We really appreciate you being here. And thank you very much.
Thank you very much for inviting me. And I wish you guys the best of luck. And I'm so excited to see the other interviews that you're going to do with our colleagues. So,
okay, great.
Yeah, good luck, guys.
Thank you.